Oh hi, my name is Nicole Velasquez, and this video is going to discuss how TriHealth won the HIMSS Davies Enterprise Award in September of 2018. TriHealth was able to win this award by focusing on three main areas. First, by optimizing their strategic payment. Second, by focusing on their surgical optimization center. And lastly, by advancing quality outcomes. Now let's take a look at their background.
Now, some of TriHealth's background, they had 4 acute care hospitals, which had 900 adult staff beds. One was a short-stay surgical hospital, and 3 freestanding outpatient surgery centers. They had over 1,800 physicians and 12,000 employees and counting. Now, to talk more about their awards, the HIMSS Davies Enterprise Award was not the only award that this TriHealth had actually won. They were a 2-time Magnet recognized hospital, a Watson Health 15 top health systems. They reached HIM Analytics Stage 7 in 2014 and recertified that in 2018.
What was optimizing strategic payment? Well, by recognizing that the payer scorecards did not reflect the high level of care that they believed they were providing, they developed a process to reconcile the payer claims and the EMR data to confirm that the payer reflected improved care delivery.
Now, taking a look at strategic payment, the value-based purchasing took a look at the gaps in care. They had over 200,000 lives in their contract, but not all of their members were in the EHR. The data was retrospective to help prospective patients. Now, the data they wanted to bring in was to help the population health and value-based health to the large number of people that they already had. Now, taking a look at where they started, quality measurement performances were something that they needed to take a look at. Now, these are the targets that needed to be met, such as screening or well care and preventive care. This is how they look early on when assessing the type of services that were to be provided to the patients.
Now, they needed to train their members and work on the small wins. A big issue were duplicates in the system, so they wanted to clean up all of those duplicate files.
Now, some solutions that they had were to automate, focus on the information, and take action. Now, let's take a look at the solutions. One of their solutions was by automation. By adding the BMI codes directly on the claim, this had actually changed the rating from a 4-star rating to a 6-star rating within 6 months. They dropped the CPT and HCPCS codes directly on their claims, and they sent the Healthcare Effectiveness Data and Information Set, or HIDIS. They also added supplemental files to the payers per patient per visit. Now, some solutions was information. They needed to identify members per contract by measure. This would show the payer gaps alongside of clinical care to see if there is a real care gap. The dashboard is also important, which shows the status of closing of care gaps to see what to focus on. Now, new member dashboards also allowed them to identify who the new members are. Action, tracking and SmartSet. The tracking tool helped the team members. It also helped with bulk ordering tools to show orders for the providers to sign, and smart tests to make ordering easier.
Now let's take a look at their second focus, which was their surgical optimization center. TriHealth recognized that patient outcomes were being impacted due to clinical variation, lack of coordinated care, patients being disconnected from their primary care providers. So they created a surgical home program, which was aimed to reduce readmissions, improve patient satisfaction, reduce same-day surgical case cancellations, and reduce surgical site infections.
Now, what is preoperative surgical home? Well, this guides the patient from the decision to have surgery through the 90 days post-discharge. It provides the patient with care protocols throughout the episode of care and to reduce costs and clinical variation. Now, a few steps for improvement were leveraging core systems, clinical pathways, clinical end-user involvement, and clinical governance. Core systems were trying to optimize Epic by looking at the EMR to improve patient outcomes. Training from implementation for those that were in the surgical homes and also for those that were not. They wanted to standardize this process. Let's take a look at where they started. This was some data from March 2016 to February 2017. The average length of stay was 8.2 days, with surgical site infections at a high of 21, 9 delayed cases, and about 14% readmissions. The average cost per case was $11,000. Now, the overall patient experience topped off at 72%. After implementing these changes, we can see that the quality outcomes really did change, increased patient satisfaction from 76% to 83%. There was an 84% response rate, which was 218 out of 260 patients. The canceled cases went from 9 to 0. Taking a look at the overall projected outcomes from 2017 compared to 2018, the length of stay dropped dramatically to 4.8. Surgical site infections went from 21 to 8. Delayed cases, again, 9 to 0. Readmission, 14% to 8.2%. Patient experience survey, 72% to 83%. Financial average cost, about $11,000 to $10,000. Now, this is based on the pre-pilot to post-pilot. Pre-pilot, we can see that the 14% readmission and cost was $13,000 for these readmission, with a total cost over $400,000. Post-pilot, the readmission rate dropped to 8.2%, with an overall total cost reduction to $280,000, which was almost half.
Lastly, advancing quality outcomes. Now, by observing a large number of SNFs, they were able to realize that their growing needs needed to provide quality outcomes by reducing the same issues as same-day readmissions in this area.
Some problems that they had. They wanted to collaborate with the SNFs to improve quality towards the triple aim. The captured data was in the form of an Excel spreadsheet, and a lot of data was retrospective and not actual. This data shows that how difficult it can be to take information gathered through an Excel report instead of using an actual reporting system like Epic. This was an example of an emailed Excel report, which is tabulated for each item compared to the Epic integrated report. Now that saved a lot of time. This is the overall projected outcomes from January-December of 2015 through 2016 and 2017. We can see the discharges from the SNFs from 39% to 82%, and the cost per member post-acute spending, 703, down to 621. The FTE expenses from $31,000 to $0 in 2017. Now, to summarize, utilizing the technology by implementing important features and capabilities to track patient information and for payers. By also focusing on why the outcomes of patient care were not up to standards, they were able to find out why. By expanding their resources as SNFs, they were able to make more moves towards being involved in other areas.
Thank you again for watching. I hope this video was really helpful for you to understand how people make a difference in the world with just a few steps. Maybe next time, you'll be part of the team that wins the next HIMSS Davies Enterprise Award. Until next time, don't forget to subscribe and hit the like button for more upcoming videos. See you later. through optimizing. Oh hi, my name is Nicole Velasquez, and this video is going to talk about how I don't know what this video is about. Why is this so hard to say?
6.5 hours later.
This video is going to discuss how TriHealth won the Enterprise HIMSS something award. Who knows?
Promise you you'll catch me.